Here from Vet Triage. We are going through the edition of Veterinary Surgery from April 2022. We're going to be talking about sterility in dogs, surgical site infection inflammation in dogs draped with a single layer Kraton elastic seal extremity drape for stifle surgery. This comes out of a specialty center in New Jersey. The objective is to compare the incidence of surgical site infection inflammation in dogs undergoing elective orthopedic surgery of the stifle after draping using either single layer elastic seal patient drape or conventional double layer drapes. Prospective clinical trial, 789 dogs. Yes, that's a good number. Dogs were divided into two groups, either conventional draping with four corner drapes and an overlying patient drape, or the Kraton seal extremity patient drape without four corner draping. All dogs were evaluated by 21 days and 6 months. Duration of follow-up was 180 days for clinical exams, 182 days for phone communications. Infection and inflammation was documented in 9 dogs after double layer draping and in 11 dogs after single layer draping by 21 days post-op, in 12 dogs after double layer and 7 dogs after single layer 6 months post-operatively, and they found no difference between the two categories. Right away, phone communications are a problem because ideally you want the veterinarian to see the dog in person, and ideally you want the surgeon who did the surgery to see the dog, not just a primary practitioner. So that's already a problem with the study. But I understand, of course, it's a large number of dogs, and you can't really make everybody come in for an in-person examination. Introduction. Historically, the published rate of postoperative surgical site infection in clean elective veterinary orthopedic surgery ranges from 2.5 to 10%. In people, drape materials and practices must align with standards of care regarding permeability, resistance to fluid penetration, thread count, and sterilization ability. Prior to 1980, my birth year, double layers were thought necessary to avoid penetration of fluids and bacteria through reusable cloth material. Current draping practice in orthopedic surgery in people favors a single layer adhesive incised drape made of disposable non-woven textile and reinforced by waterproof plastic. Adhesives are used to secure drapes instead of penetrating towel clamps. Conventional draping for canine orthopedic stifle surgery involves 2 layers with 4 non-woven disposable drapes secured with towel clamps and a second fenestrated patient drape overlay. Towel clamps are used because adhesives do not create an effective barrier to canine skin. And that's the picture you see there is stifle surgery, and the surgeon is wrapping the distal part of the limb with sterile vet wrap. And then the rest of the dog, you can see there the towel clamps, four corners there of the towel clamps. And then this picture here shows basically what I'm showing you there in the picture. The World Health Organization has stated that the cost of reusable and disposable drapes is likely similar, but the amount of waste generated and the ecological burden is higher with disposable, especially with multiple layers are used. The Kraton elastic seal extremity drape was adapted from use in people to provide a practical non-adhesive patient drape for canine orthopedic surgery. Modifications from the version used in people include a smaller oval-shaped aperture and larger overall dimension. The Kraton drape is designed for use as a single barrier layer, an impermeable drape that can be used in our canine patients as a single layer without the need for towel clamps or adhesives, may decrease tissue trauma, improve ecological impact, and decrease surgical time compared to conventional draping. Regarding materials and methods, these cases were collected between 2019 and 2020. That's how you know it's a pretty high-end, busy surgical practice. That's only barely 1 year, and they collected 800 cases for this. Preparation for aseptic surgery included diluted 2% chlorhexidine solution, a 5-minute scrub, and then 2% chlorhexidine. The surgical site was then wiped clean with isopropyl alcohol. And then in regards to surgical technique, perioperative management, morphine was used with or without acepromazine. They used propofol, isoflurane, oxygen. Cefazolin was the antibiotic that was given at induction and then repeated every 90 minutes when necessary. Cefazolin was then given IV every 8 hours in the hospital. The antimicrobial prescribed by the surgeon was either cefpodoxime or clavamox, which again, there's a problem there with standardization. You want every case to be treated the same way, but again, it's 800 cases. It's a lot, but it'd be nice to standardize it. Incision evaluations were performed either in person or via telephone with or without digital images. Wounds were documented as infected and inflamed at either follow-up if purulent drainage, abscess, or fistula was present, or there was septic arthritis, any redness, swelling, pain, heat, serous discharge or dehiscence, and any joint effusion, lameness, or pain on palpation of implants. Results. They performed a variety of surgeries, all orthopedic, tibial tuberosity advancement, tibial plateau leveling osteotomy, lateral suture, medial patella luxation, lateral patella luxation, some combinations were performed. The size of the dogs, most of them were large dogs at 34.1%, followed by medium dogs at 28.64%. The most common surgery was the tibial tuberosity advancement, TTA, 60.84%. 49% of dogs received double layer draping. Of those, mostly female, spayed at 51%. Size of dog, most of them were large dogs at 31.54%, and most common surgery at 60.51% was tibial tuberosity advancement. Surgery was performed on the right side in 51.54% of dogs. Meniscal release, 47.18% of dogs. Meniscectomy, 40.51% of dogs. Mean duration of anesthesia for dogs with conventional draping was 73.85 minutes, so a little bit over an hour. 50.57% of dogs received a single layer drape with a Kraton extremity drape. Spayed females were most common at 49.62%. Large breed dogs most common at 36.59%. Tibial tuberosity advancement most common at 61.15%. Left stifle most common at 50.63%. Meniscal release 53.13%. Meniscectomy 34.34%. Mean duration 73.36 minutes, which is basically the same as the double layer. Follow-up, a total of 1,641 incisions. Wow. The mean time to initial follow-up was 12.58 days. Mean time to final follow-up was 65.66 days. The primary institution evaluated the dogs at 71.05% rate. Following initial follow-up, the number of clinical examinations was performed in 60.68% of animals, and then in final follow-up, 80.83% of animals, with mean time to direct follow-up was 61.99 days. Indirect evaluations for the duration of the study was in 28.95% of dogs. The mean time to indirect follow-up was 11.75 days. The remaining observations were by phone in 49.52% of cases. In the indirect evaluations at the time of initial follow-up, that made up 34.11% of dogs. Mean time to indirect final follow-up was 84.5 days via telephone with the owner, occurring in 79.63% of cases. Lastly, regarding inflammation and infection rate, at initial follow-up, 2.53% were infected or inflamed. 45% of those received conventional double layer draping and 55% single layer. At final follow-up, 2.4% had infection inflammation. Of those, 63% conventional draping, 36.8% single draping. A total of 36 incisions, or 4.56%, were diagnosed with infection or inflammation at the completion of the study. A total of 10 incision cultures were obtained at final follow-up, which is 62.5% of cases. Of those, 60% positive, 40% negative. Discussion. No difference in post-op incision infection inflammation was detected between the two techniques. That's the bottom line. Surgical site infections are divided into superficial incisional, deep incisional, and organ or space surgical site infection, and those criteria include positive wound cultures. 27.78% of surgical site infections were confirmed via positive culture of the incision in this study. The overall infection inflammation rate of dogs in this report was 4.56%, which is comparable to other studies. 2.15% of the incisions, that were infected or inflamed were diagnosed at the time of initial follow-up within 3 weeks post-op, and then resolved by final follow-up at 6 months. The other half, 2.03% of the infected and inflamed incisions, were normal at the time of initial follow-up, but then had evidence of infection and inflammation between 22 days and 6 months following surgery. Non-penetrating towel clamps can be used, but are not as reliable for preventing drape movement. A study evaluating the use of adhesive incised drapes in hip surgery in people showed a twofold increase in bacterial contamination of incisions where the drape had separated from the skin compared to those that remained well adhered. Research dogs evaluating the use of adhesive incised drapes for spays and stifle surgery documented over 90% drape adherence in only 48 out of 100 dogs, and variable drape adherence overall ranging from 0 to 100%. Terrible. Inflammation of the surgical wound can be caused by self-trauma or overactivity. They recommended e-collar for 2 weeks minimum, restricted activity for minimum of 6 weeks. Antimicrobials were given for 7 days in all the dogs in this study. Previous research demonstrated a significant decrease in surgical site infection rates when antimicrobials were administered after clean orthopedic surgeries. It always surprised me, those surgeons that don't use antibiotics to go home with after surgery. It's crazy. Dogs are just not people. As dumb as that sounds, they're a different animal, literally, and they need some antibiotic coverage, especially if the risk of infection can be catastrophic. If you have an implant in the stifle and you get an infection, it's very difficult to remove, and you risk losing the leg or having permanent dysfunction of that limb. So you want some antibiotic coverage. Iodophor or antibiotic impregnant incised adhesive skin drapes are often used in addition to single or double layer draping in dogs and people. However, their benefit to reducing surgical site bacteria counts is unclear, and some authors associate them with increased infection following clean orthopedic surgery in people due to poor drape adherence and more rapid bacterial colonization of the incision. So that's the paper. Pretty solid, large number of dogs. A few issues that I have with it, but otherwise really good. Nice work to the specialty hospital. It's hard to coordinate specialty hospital research papers, but at least you have, they probably have interns and residents who can also help with the paper. So we'll see you guys in the next video. Thank you so much.